Hello, everybody. Welcome back. This is Amanda Ridout, health coach, and we are back for part 2 of our acne series with pharmacist and cosmetic chemist and my wonderful friend, Ben Fuchs. Hi, Ben. How are you?
I'm doing good, Amanda. How you doing today?
Fabulous. Thank you very much.
So we're
Talk to
talking
us.
acne.
Yeah,
We're going to talk.
acne.
Yeah,
Okay. We are on, I think we're on
adrenal
adrenal
acne.
or stress. Stress, right? Wouldn't that be
The
stress
adrenal
acne?
glands have a reputation, or they're known as your stress glands, your
Okay.
stress fighting glands. But there's so much more than that.
Mm-hmm.
Your adrenal glands are really, in addition to being stress glands, they're hormone-making glands, and this is especially relevant for women when they stop making ovarian hormones. They're supposed to start. The adrenal glands are supposed to pick up the slack. So estrogen, testosterone, progesterone. These are hormones that are typically made in the female reproductive system. After menopause, a woman's reproductive hormones, or the hormones that are made in the reproductive glands, start to diminish. The adrenal glands are supposed to pick up the slack, but because the adrenal glands also make stress hormone, especially cortisol, if your adrenal glands are off busy making stress hormones, they're not going to have the raw materials to make estrogen and progesterone and testosterone, and that's a big, big problem.
Yeah.
That's why for women who are going through menopause, they want to make sure that they're relaxing the body and they're not producing too much cortisol or too much stress hormone, and that's one of the reasons why women get hot flashes. In fact, hot flashes and many of the signs of menopause, anxiety, or symptoms of menopause, anxiety, insomnia, mood changes, mood lability, moods that go up and down, etc. A lot of these are related to the fact that the adrenal glands are burnt out from cranking out so much cortisol, from handling sugar or handling psychological stresses. They can't make estrogen and testosterone and progesterone. So relaxing the burden on the adrenal glands, keeping the adrenal glands from shunting cholesterol into making cortisol so that it can have the raw materials to make estrogen and progesterone, is a major strategy for keeping menopausal symptoms at bay.
Wow.
Okay. Interesting, but that has nothing to do with acne. That's just
no.
So here's the thing about adrenal acne. It's very similar to androgenic acne. Remember, the first type of acne, androgenic acne, which is a big word for saying male hormone acne, is a type of acne that's related to how the body processes testosterone or male hormone. Now, remember, women make testosterone just like men make testosterone, so we don't want to be thrown off by the term male hormone acne. In any case, androgenic acne is related to testosterone. Now, adrenal acne is similar in the sense that it also involves testosterone, but it has the added wrinkle of stress hormone, adrenal hormone called cortisol. So adrenal acne, in addition to having the male hormone component where the body's not processing male hormones correctly and you end up with inflammation and you end up with cells dividing too rapidly and the plugs that we talked about and the oily skin, adrenal acne has the added wrinkle of having cortisol, which exacerbates skin oiliness. In fact, this is the hallmark sign of adrenal acne: oily skin and blackheads. And this is and also enlarged pores, because sebum comes out of the pores and that can cause the pores to appear larger. Pore size is typically not going to change, but they can appear larger if there's a lot of sebum that's coming through there. So adrenal acne is very similar to male hormone acne, but it has the added wrinkle of having extra oil and blackheads. In fact, if you have oily skin in general, even if you don't have acne, you just have oily skin and you want to kind of tame down the oil, you want to regard that skin oiliness as the skin manifestation of hyperadrenal activity, of a body in duress, if you will. That duress can be caused for psychological reasons. It could be caused for mental and emotional reasons. But from a physical perspective, bodily duress that can lead to adrenal acne and oily skin is usually caused by sugar. It can also be exacerbated by digestive problems as well. In fact, those are the two major burdens on the body. Well, there's a few others. Nutritional deficiencies are also a burden. But the major burdens on the body that can show up as oily skin or some of the signs of adrenal acne are, number one, sugar and its counterpart, insulin. And number two, digestive distress. And those are the two things that you want to focus on if you have the added wrinkle of adrenal acne in addition to your androgenic acne. So you have the T-zone kind of thing, which is your androgenic acne, your male hormone acne, but you have a lot of blackheads and you have a lot of skin oiliness, then you're probably dealing with a stress component as well. If that's the case, then there's a couple of strategies that you want to do. Number one, it's very important to keep your sugar intake down. Last time we talked about how there's an overlap between insulin and male hormone. Well, it turns out that there's an overlap between skin oiliness and male hormone as well. So, and also cortisol as well. So between testosterone, cortisol, and insulin and sugar, those are your main reasons why you're going to have skin oiliness. So keeping your sugar intake down is job number one. Now, I'm not going to talk about, because we talked about in the last tape, zinc and vitamin A and some of these other nutrients that you can use for male hormones. Strictly for dealing with the adrenal glands, it's very, very important to make sure that you're keeping your insulin low and keeping your blood sugar stable. That means, for many of us anyway, means changing the way we eat. More protein, more fat, and less carbohydrates, and especially refined carbohydrates and flour. The second thing that can stimulate the adrenal glands and cause oily skin and cause bodily duress is caffeine. And a lot of people are drinking, a lot of kids are drinking Diet Coke, Coke and Mountain Dew and soda pop that has a kind of a double whammy, because it's got the caffeine and it has the sugar. So weaning yourself off of sugar and weaning yourself off of caffeine-containing drinks, especially soda pop, is also going to be helpful if you're dealing with oily skin, blackheads. In addition to type 1 acne, androgenic acne, you have the type 2 adrenal type of acne. So number one, keeping your sugar intake down. Number two, keeping your caffeine intake down. Number three, it's very important to keep, if you have any food problems, digestive intolerance, food intolerances, digestive problems, it's very important to stabilize the digestive system. This is a major cause of bodily duress. So any kind of digestive symptoms need to be regarded as some kind of problem, some kind of potential problem with bodily duress. So correcting food allergies, eliminating food intolerances, staying away from problem foods, even eating less food. Even eating less food in general and less calories in general can be a way to calm the adrenal glands down and stabilize oil production. Another factor with adrenal adrenal acne doesn't so much involve excessive oil as much as it involves thick, sticky oil.
Okay.
It turns out that the oils, skin oils, and the technical name for skin oils is sebum, S-E-B-U-M. It turns out that the sebum, or the skin oil of acne patients, tends to be thicker, and it tends to be deficient in omega-6 fatty acids. So, number one, using your ultimate EFAs, and it's kind of interesting, because a lot of folks will feel like, oh, my skin's oily, I don't want to take my essential fatty acids because I have oily skin, and they're not understanding necessarily that it's not always too much oil. Sometimes it's thick, sticky oil, and omega-6 fatty acids have a liquefying effect on sebum. So using omega-6 fatty acids, which you can get in your ultimate EFAs, is another strategy. Go ahead.
I have a question. Okay, you say omega-6. Now, that is one of the most abundant omegas that we get, no?
Supposedly. Supposedly.
Oh!
Here's why. When you cook an oil, you destroy the omega-6. And it doesn't take much heat either. Even there are some scientists who believe that your body heat, even the inside heat of your body, can break down omega-6s. So it doesn't take much cooking or processing to remove or at least break down the omega-6s from your oil. So when they say we're getting too much omega-6s or we're getting lots of omega-6s, what they really mean is we're getting lots of omega-6 containing oils, or oils that should have omega-6s. We're eating lots of corn oil, we're eating lots of safflower, sunflower, sesame, soy oil. These are oils that contain omega-6s theoretically, but what's not accounted for is the fact that these oils are fried or they're processed in some way. So the omega-6s aren't in there. Yeah. So yes, theoretically, you hear people saying that we're getting lots of omega-6s, but really we're not getting lots of omega-6s. We're getting lots of the oil that should have the omega-6s in them. So that's a big difference.
That is a big difference.
Sticky oil or sticky sebum, omega-6s. Essential fatty acids have multiple roles to play in improving the acneic condition. They're anti-inflammatory, especially omega-3s. They improve healing, skin healing especially. In fact, the skin is the most important place where omega-6s play a role. They play a role in everything in the body, but I don't want to say the most, but one of the most important roles for omega-6s and especially omega-6s is to keep skin healthy. Omega-3s have an anti-inflammatory effect. Omega-6s keep skin and skin cells healthy. So they're both important. So your ultimate essential fatty acids are important for liquefying sebum, making sebum more liquid so it flows out more and doesn't clog up the pores. Another very important nutrient for the adrenal glands is zinc. In fact, zinc might be the most important mineral for the adrenal glands. We talked about zinc last week for male hormone acne. Right. Well, zinc is also very important for the adrenal glands. 50 milligrams of zinc picolinate is a must-have. One of the most interesting nutritional supplements for drying up excess sebum is vitamin B5. Turns out that vitamin B5, pantothenic acid, is involved in how the body processes fats. how the body processes oils. Deficiencies in vitamin B5, deficiencies in the whole B complex are very common. They're water soluble. They're flushed out of the body. Here's the thing about vitamin B5. It's not enough just to take a little bit of vitamin B5 to get the anti-sebum or anti-oil effects. You got to take big doses of it. I'm talking gram doses. The recommended daily allowance, I think, is something like 30 milligrams or 40 milligrams. It's very small. So we're talking 100 times the recommended daily, or the RDA. In fact, even 200 times, 6 grams of it. When I was younger, I was taking 6-7 grams of pantothenic acid every day, and it had a dramatic effect on my skin oiliness. So vitamin B5, also topically, vitamin B5 can be effective. In fact, I formulated a product many years ago called drying lotion that used vitamin B5. It was a topical vitamin B5 in addition to topical zinc. So you can break open a B5 capsule and put it into a gel, or put it into a liquid and make a toner with it. Or you can even put it into oatmeal and make an oatmeal mask with it. Oatmeal is also very drying. Has a drying effect on sebum. Vitamin C is also important for the adrenal glands. Minerals in general. Your adrenal glands are your mineral processing glands between the kidneys and the adrenal glands. And the adrenal glands are called the adrenal glands, renal for kidney, because they're right on top of the kidneys. And in a way, they're kind of like a satellite of the kidneys, in the sense that the adrenal glands regulate minerals like the kidneys regulate minerals. So you can tell you're having an adrenal problem or adrenal stress problem if you're craving salt. In fact, salt cravings are usually associated with stress and with excessive adrenal activity. So using Celtic sea salt in water, using your colloidal minerals, that can help replace your salt. Minerals obviously are a form of salt. I like Celtic sea salt because I like the taste of it. If you put it in water, it tastes really delicious when you do a couple of sips of it. And then it tastes less delicious over the course of a few sips. But the first couple of sips of Celtic sea salt in water are really, really tasty. You should try it.
I use it on food, but I haven't done that.
Try it, put half a teaspoon in a glass of water, and then sip on it. It's very tasty.
I like the cherry mints, our plant-derived minerals in cherry juice.
Cherry? You put it in cherry juice?
No, the cherry mints is the minerals in the cherry juice. It is
you can use that.
Good.
And the Beyond Tangy Tangerine, of course, that's also good. But the thing about Celtic sea salt, it gives you that hit of salt that we all crave. You know how you like salty food and people like to put salt on things?
Lime and salt.
Well, you get that hit of that salt when you use your Celtic sea salt. Not that the colloidal minerals and the cherry mints aren't good, but you don't get that hit of salt with those. Let's see a couple other things. Topically, for getting rid of oil on the skin, salicylic acid or glycolic acid are two really good topical ingredients. You can use salicylic acid toners, you can use glycolic acid toners, or you can use glycolic acid cleansers. You can get glycolic acid off the internet, or you have a pharmacist, you can buy it from a pharmacy, and you can just add it to a cleanser and then make your own little glycolic cleanser. Now, you have to know what you're doing because it's not stable. It'll break down the cleanser, but for just one dose, you could put a couple of drops in your hand of your glycolic or your salicylic and put your cleanser in there and make a quick impromptu glycolic cleanser or salicylic acid cleanser, and that can have some nice oil absorbing properties. Talked about oatmeal masks earlier. Bentonite clay or kaolin clay, which are readily available in health food stores. Those are also also have a nice oil sopping up benefit. And zinc oxide powder has a nice oil sopping up benefit as well.
So let me ask you this. You mentioned this is the acne in the T-zone.
It'll still be T-zone. No, that's a little different. That's a little different. We'll talk about that next time.
Okay.
Here. Now, what you'll notice is there's something that distinguishes, and I'm not going to tell you what it is now. We'll talk about it in our next video. There's something that distinguishes the T-zone from the rest of the face. And this is why T-zone acne is distinct from the other forms of acne. The T-zone is a special form. It's actually not a special form. The rest of the skin is a special form of skin. It has something that the T-zone does not have.
Okay.
That's very interesting, right? The T-zone part of your face is different biochemically from the rest of your face, and this is why you can tell what kind of acne you're dealing with by looking where on the face where geographically on the face your pimples appear. If it appears in the T-zone, you're looking at type 1 acne. If you have a lot of oil with it, you probably have either a component of an element of type 2 acne. Now, if you just have oily skin, but you don't necessarily have blemishes, or you have a few blemishes, but your skin's really oily, then you're dealing with an adrenal condition more than a male hormone condition. Okay, makes
Yeah.
sense? If you
Yep.
have the breakouts and you got the comedones, the pimples, and we should someday probably on a video, we never really talked about what a pimple really is. We should probably talk about that.
Okay.
Maybe we'll do that next time. In fact, we will do that next time. We'll talk
Okay.
about what a comedone really is. Technically, that's a technical name for a pimple, a comedone.
Okay.
In any case, the T-zone, the breakouts that occur in the T-zone are distinguished from the breakouts that occur everywhere else because the biochemistry of the T-zone is different from the biochemistry of the rest of the skin. Okay, let me see if there's anything else. Oh, a couple of signs, a couple of ways you could tell that your adrenal glands are working overtime. We talked about salt cravings. That's a classic sign. Another sign of overworked adrenal glands, which can cause oily skin or type 2 acne, is what we call postural hypotension. Okay. Postural meaning your posture, right? Hypo meaning low, tension meaning pressure. So hypotension, low blood pressure, it's related to posture. So that's postural hypotension is when you change your posture, like from a sitting position to a standing position, or if you're laying in bed and you get out of bed, or if you're bending down and you stand up and you feel dizzy and you feel a little, that's postural hypotension, and that's a classic sign of adrenal burnout. So if that occurs, you either just drank a bunch of coffee, or you've been drinking a lot of Coke, or you, even worse, you have long-standing chronic adrenal burnout. If that's the case, then you want to do all the things that we're talking about here for calming the adrenal glands. Vitamin B5, zinc, vitamin C, salt. I forgot to tell you about vitamin B12. That's also very important for the adrenal glands. You can get something called liquid adrenal extract, which is actually a glandular adrenal. That can also be very helpful for the adrenal glands. A couple other signs of adrenal fatigue or excessive adrenal activity, insomnia, or if you get up in the middle of the night but you can't fall back asleep, and you can't fall back asleep, you get up in the middle of the night and you fall asleep and then you get up in the middle of the night and you can't go back to sleep, that's a sign that the adrenal glands are working overtime. Or if you have a good night's sleep but you wake up tired, that can also be a sign that you're dealing with some adrenal burnout. And really, the way our culture is structured, for most of us, between diet and our society and our lifestyle, you can pretty much rest assured that if you're not supplementing, you're not really taking care of yourself, you're probably dealing with some degree of adrenal burnout or adrenal fatigue.
So we're just going to assume that everybody that listens to us is already taking the Beyond Tangy Tangerine or is headed that way. They should be. Are all these extra? Are all the supplements?
Extra. These are extra.
Okay.
These are extra. Zinc is extra. Vitamin B5 is extra. You're going to get the vitamin C. Vitamin C for the adrenal glands is very important. And you'll get that in the Beyond Tangy Tangerine. You'll get the minerals in the Beyond Tangy Tangerine. Magnesium is also, I forgot to mention that, that's also important for the adrenal glands. And you'll get that in the Beyond Osteo FX, of course.
Yeah.
And then you'll get magnesium.
I take that right before I go to bed.
It helps you sleep, right?
The Osteo.
Yes, magnesium is very, very relaxing.
Oh, yeah.
Magnesium's a tremendously important mineral for relaxing, for the brain, for detoxification, for the adrenal glands. In fact, magnesium and zinc deficiencies are probably the two most common mineral deficiencies. I'm trying to think. I would have to say magnesium deficiency and zinc deficiency are the two most common mineral deficiencies, and those are the two most multifunctional of all the minerals. Zinc is involved in probably 100 different chemical reactions in the body. Yeah. Magnesium is probably double that, 200 different chemical reactions in the body. So between these two minerals, which are the most notorious mineral deficiencies, maybe the most notorious of all nutrient deficiencies, because of the soils partially and because of how we eat, you're dealing with 300 different chemical reactions that aren't operating to at peak efficiency. That means just with two little mineral deficiencies, which are ubiquitous, which are tremendously common, you have compromised the body in 300 different ways. Well, just with two minerals.
And if I could add, a lot of people might run out and just get on magnesium and zinc, but all those two have cofactors.
Absolutely.
And so the Beyond Tangy Tangerine, you get the perfect combination, and then you add the extra that you might be lacking.
Yes, the Mighty 90 Essential Nutrients is always the baseline of everything. And that gives you and that's the Healthy Start Pack. That's the genius. That was Dr. Wallach's genius. He made it so simple. Yeah. That you got 90 essential nutrients, and they're all in the Healthy Start Pack. Now you are going to, for specific health issues like androgenic acne or adrenal acne, you're going to need a little bit extra B5 maybe, or you're going to need more zinc, or you're going to need more magnesium, or you're going to need individual nutrients in a little bit extra abundance. But the bottom baseline foundation of the whole program is going to be your Healthy Start Pack and the Mighty 90 Essential Nutrients.
Yes, absolutely. Okay, wow. Well, I'm excited for our next video.
Next one's really interesting.
Okay.
That one's I'll give you a little, just give you a little
A teaser?
Yeah. The way I look at it, and I've been dealing with acne now as a professional and personally for most of my life, really, it's the most tragic of all the types of acne because it's the easiest one to turn around and it's the one that is most misunderstood and most incorrectly treated. Of all the 7 types of acne, this is the one that's the most incorrectly treated, yet it's the easiest form of acne to turn around.
Wow. Okay, everybody. So stay tuned because we are going to come back with part 3. And that is going to, do we want to give the name of the acne or just have them wait?
Well, we already told everybody. It's digestive acne.
Digestive acne. Oh,
yes.
gosh.
Yes. And it is the most tragic form of acne, but it's the easiest to turn around.
Okay, wonderful. Well, thank you so much again for all your knowledge, all your information, and for sharing this with us. And everybody, stay on your 90 and let's clean up our digestive system. And we're going to learn how to do that a little more next time.
Let me say one last thing.
Sure.
Can I say one last thing? Zeolite, I forgot to mention. Zeolite can also have a nice little mopping up effect on skin oils.
Zeolite is another earth.
It's a mineral. It's a kind of mineral substance.
Okay.
And you know what? You can get zeolite off the internet. Haven't seen any stories, but you know who's making zeolite has an interesting property in that when you add water to some forms of zeolite, it gets hot. And there was a product called Biore, I think it was called.
Yeah, Biore. Yeah.
And it used to get hot. Remember how they had a Biore that got hot?
I never really used their products, but
There was one Biore that got hot, and that was made with zeolite. And as soon as you wash your face, as soon as you add water to the Biore product, and I forgot if it was a powder or what it was exactly, it would release heat. It would have what they call an exothermic reaction, where heat is released and you'd feel hot.
Okay.
And that's just a little chemistry, fun with chemistry kind of idea that happens with zeolite. But zeolite does mop up excess oils. And you can get zeolite off the internet, or a Biore also contains some zeolite.
Okay, wonderful. Thank you. We'll see you next week.
Okay, bye-bye.
Bye.